Hi, good morning everyone. I'm Rahul Nanuhal, COO at Cureka.com. We are back with our Instagram live session, and the topic of today's discussion is about having a beautiful smile. What more can be beautiful than having a beautiful smile, which is the first thing anyone notices in you? We are going to be joined by a specialist doctor today, Dr. Pathumai, who is a maxillofacial surgeon, and she is going to help us with understanding what can we do to brighten our smile. So at Cureka, we serve millions of people to help them lead a wonderful life, have beautiful smile, take care of your kids, take care of your health, take care of elderly people. We've got products across 9 different categories, across 500 plus national and international brands from which you can choose. Still, if you have got concerns, some specific ones for people who are having diabetes, renal, kidney, any other issues, we have got free of cost WhatsApp platform which you can use to connect with our health experts. You can ask your questions for free, and our care experts will come back to you after consulting with the doctor within few time. So now we have also got a retail store at Indiranagar, Bangalore, where you can visit and directly interact with our care experts and understand what are the best products for you to lead a healthy life. At Cureka, we keep the vision very, very close to us to build a healthy India. And with that aim and goal in mind, we keep on progressing towards our next steps. We have more than 15,000 different products on the website which have been proven clinically to help you lead a healthy life. These products, you can see them live on the website. You can see a lot of doctors recommending these products. Typically, you would not find these products at supermarkets because these are not some generic products. These are very, very specialized products that typically only doctors do prescribe or inform you about them. But these are not prescription based. These are over the counter products you can find in some specialist pharmacies also. And some of them are imported from international brands and provided. Dr. Pathumai is going to join us now. Good morning, doctor.
Good morning.
Thank you for joining us today. We're going to talk about a very, very important topic about brightening your smile. You know, what more can be more important than just have a lovely smile? And what more can be great than have, the wonderful Dr. Pathumai with us to speak on this topic, right? So thank you so much for joining us, doctor.
Thank you.
Yeah. So let's start with our first question for the day. What are my teeth whitening options? If I want to whiten my teeth, what are my options, doctor?
Okay. So the current trend and the era has gone more towards whitening your teeth. So everyone loves a beautiful smile. They want to be beautiful. So teeth whitening procedure has become very common these days. So coming to a tooth whitening option, I would say one thing is what we dentists can do. So we dentists will prescribe you either a professional, the tooth, depending on what the stains are, depending on the vitality of the tooth. We will have an in-office procedure, which could be either the regular bleaching or it could be a walking bleaching, which is especially for the non-metal tooth. Or we may recommend you home care sets, which we will be using for a minimum of 3 to 4 hours per day with a maximum of 6 to 8. and you'll be using for 2 weeks plus. So that will be what we prescribe. And you also have over-the-counter products. So what you get in the markets generally, you can have whitening formulations in the form of dentifrices of toothpaste, mouthwashes, chewing gums, varnishes, or whitening strips, whatever may be. Or even recent days you have tooth whitening pens too. So these are various options that are available.
Wonderful. So, and then what would be specifically your recommendation, doctor? So, what do you recommend for us to, like, in general, have a healthy smile and a beautiful smile?
Healthy smile depends on your oral hygiene measures that you take. Your cleanliness of your tooth is very important. You have to maintain your gum hygiene. And for a whiter smile, what I would recommend is visit us. Rather than trying prescribing yourself the medications or the products available in the market, do visit us. We will recommend you depending upon the type of stain. So the market available products are not prescribed for every type of stain. They are only prescribed for your food stains or smoking, things of that sort. So if you want the entire the process to be complete and it has to be effective, then you will have to visit us.
Right. And typically people want instant results. So, how long does it take to actually have this teeth whitening procedure done?
Okay, if you want immediate results, then it is an in-office procedure. So depending upon the tooth vitality, we will let you know like which procedure to go for. And the in-office procedure is always the best. It uses high concentration of bleaching agents, and it will take per session will take you around 40 to 45 minutes. A single application will take around 20 minutes. So what we do is we basically apply these gels on the teeth over your upper and the lower after creating a gingival barrier especially. So the gingiva or the soft tissue has to be protected from the bleaching agent. So we'll give you a gingival barrier and then we'll apply gels or the formulations that we have, and you may be the process may be initiated or it can be more effective using a blue light. So this is how an in-office procedure is done, and it may take 40 to 45 minutes. The results are very good. They are almost immediate.
Oh, wonderful.
Per session, you can apply for 2 to 3 times per session.
Okay, right. And people across all age groups can go for teeth whitening, or you suggest particular age groups?
Yes, particular age groups. When it comes to aesthetic concerns, I would say it's better if you're 15 plus, 16 plus of age for you to go for aesthetically concerned tooth whitening. But if a child who has fallen down, he gets a black tooth, a single black tooth. So this could be because of a trauma. The discoloration is it's from inside. It's called an intrinsic character of the stain. So for such children, because it is a black tooth, especially the front tooth, is going to affect him psychologically. So for him, you can go for single tooth whitening procedures. Otherwise, it's better to go for after 16.
Right. And are there any potential side effects of teeth whitening?
Yes, reversible side effects are there. So reversible, I mean few people may have mild sensitivity, mild gingival irritation. So these are temporary. So after a session, if they develop hypersensitivity, we will prescribe them a desensitizing paste. Maybe in 2-3 days or in a week's time, it will get settled. And it's very important that it is cautiously done.
And is it safe for our teeth to go for the teeth whitening? Because people do say that it gets scraped or probably the strength gets reduced or something.
It is safe. It is safe for first 2 or 3 applications. But if you're going to repeat the application, then eventually it will damage your enamel. So once you go for a bleaching procedure, the next time you go for a bleaching procedure, the time interval frequency should be increased.
Okay. Right. And can this procedure of teeth whitening, it can have the potential to damage the enamel or cause any sensitivity around the tooth or gums?
Yes, more than 2 or 3 applications, the same visit, that can in turn damage. or very long-term teeth whitening procedures, they can damage. Short-term or a single tooth whitening procedure will have a transient effect. It will not have a permanent damage.
Okay, so temporarily or probably a day or two, you can feel some sensitivity around your teeth.
Yeah, for a day or two, you may feel sensitivity, not for everyone. Yeah.
Okay, not for everyone. Understood. Right. And are there any particular food that we should avoid which cause discoloration of the teeth?
Yes, there are, because when it comes to stains, there are two types of stains. One is extrinsic, which is because of the foods and beverages you have. The other one is intrinsic, which is mainly because of the tooth development. It could be a tetracycle stain, it could be because of increased fluoride content, which is called as a fluorosis stains, or sometimes the enamel itself can be malformed or hypomineralized, which is genetic in nature. So when it comes to them, they are called as extrinsic stains. So intrinsic stains. The extrinsic stains are those which come from your food. So after your bleaching procedure for at least 48 to 72 hours, it is better you avoid colored foods or acidic foods like citrus drinks or colored foods like anything like coffee, tea. You can have vermin rather than preferring for coffee or tea. And also you have to restrict sugary food intake. So these are some restrictions to be followed. It's better you follow them.
Okay. And once you go for the procedure, how long these results last?
As long as you restrict yourself or minimize your extrinsic stains. Smoking, coffee, tea, wine, dark colored beverages, it's better to restrict them.
Right. So these beverages also have a hand in discoloring the teeth, like, these Coca-Cola or, whatever drinks are there, soft drinks are there. They also have the potential to discolor your teeth.
There are few drinks that itself can cause erosive effects on your teeth enamel. So it's better to avoid highly acidic beverages.
Understood. Okay. So now an interesting question which you just also touched upon was that how often should we whiten our teeth?
Yeah. Preferably after a single sitting of bleaching, it's better to do the next sitting at least a year later. So maybe 2 or 3 applications per sitting is okay, but after that it's better to increase the frequency or the interval of application.
Right. Okay. So now, can anyone go for whitening of the teeth after they have the dental restorations, such as fillings or crowns? Like after they should go for the.
Okay. So basically, what we do is the whitening agent, the bleaching agent is for the tooth. It's meant for the tooth. So we do not place them on crowns or your dental fillings. The main reason is the thing is like once you go for bleaching, the highest effect is seen on your tooth, not on the restorations. So when you do a bleaching, the teeth may look more brighter than your restorations, and eventually you will have to go for refilling your anterior zones.
Right. And it works on the whitening works on all kind of stains or only some specific stains?
It works on every type of extrinsic and intrinsic stains. But if the enamel is deformed or malformed because of hypomineralization, because of some genetic issues like amelogenesis imperfecta, dentinogenesis imperfecta, then it will not work. Or in cases of very severe fluorosis, it may not work. So for such cases, we would suggest a veneer or a crown.
Right.
For almost many stains, it works. But for few stains where the enamel itself is malformed, it does not work.
Understood. Right. So, what is the simplest way by which people can just maintain the good color of their teeth, the natural color of their teeth? What are the simple some habits that they can develop?
To restrict having colored beverages, coffee, tea. Restriction, or if you have them, wash your mouth immediately, rinse them well. So these restriction should be there. Not having highly acidic foods.
So people like me, I'm very fond of coffee. So I do have a couple of times in a day. So should I leave that?
After that.
Okay. All right. Understood. So we should go for washing of the oral hygiene. Need to have. Understood. Right. Okay. And people from specific, habits like chewing of tobacco or something, they will also have a lot of stains on their teeth. So for them, what do you recommend? Also,
first go for scaling and polishing. Procedure first they have to go is scaling and polishing, and most importantly before that, stop your habit. Stop your stop tobacco chewing, stop pan, because they even cause cancer. So it's better to avoid them, and then come to us, do a scaling and polishing. After which, if it for furthermore stains, you can go for whitening.
Right. Understood. And do some people have genetically yellow teeth, which are like not white in color? Is that also possible?
The natural color of the teeth varies. Varies from people to people. It varies depending on your enamel matrix, which develop in the developmental stages. Especially when you have an enamel defect disorder like amelogenesis imperfecta, the tooth color is more brown. So more yellow to brown.
Yeah. So in those cases, if those people would like to have a whiter teeth, so what can they choose from? What are their options?
No, you will have to come to us. We will see the level of defect. So whether it is too bad, then you may have to go for a root canal and a crown. And if it is more superficial, just a veneer, direct or an indirect would do. Depending upon the level of enamel or dental deformity, we will prescribe you various solutions.
Understood. So once people go for the teeth whitening process, so how can they, after the procedure, how can they maintain it? What will be the maintenance step?
Okay. Following the white diet for the first 3 days is important, which includes not taking colored foods, not taking acidic foods, and not taking sugary foods. After which, maintenance of proper good oral hygiene is very important. Immediately after the bleaching procedure, we ask the patients not to brush immediately, at least for an hour. Do not brush your teeth. So we give certain instructions that have to be followed.
Okay.
And you should minimize the colored foods like coffee, tea intake. You can minimize.
Okay. Now, so there are also some OTC products available in the market for teeth whitening. Now, if somebody is having sensitive teeth, then should they go for these teeth whitening products?
No, it's better. It's recommended not to.
Okay.
That's chance that your sensitivity may increase. So, for people with sensitivity, it's better to avoid bleaching. Unless and otherwise, the sensitivity is resolved first.
Understood. So, guys, if you have any questions around your teeth, please do ask us in the comment section below so that we can take up during this session, or we can come back to you after this session to answer your questions around teeth, gum health, teeth health, whitening of teeth, or anything that you have some specific questions in your mind. Right. Moving on, we have got the next question for our doctor. So what should we do if we experience sensitivity or pain after the teeth whitening process or the procedure?
Okay. For this, as told before, sensitivity is transient. It's going to be, it is reversible. It is going to be for a few days or a couple of days. So you can use the desensitizing toothpaste, which is available in the market. Sometimes remineralization toothpaste are also available. Even they will be helpful.
Understood.
So avoid taking extreme colds like very hot and cold foods. That should be avoided for people with sensitivity after bleaching. Avoid having acidic foods. So they are points to be remembered.
Understood. So, doctor, can teeth improve their appearance? Teeth whitening improve the appearance after the dental restoration? Does it improve
After,
the appearance?
I didn't get your question.
So, can teeth whitening improve the appearance after
No,
the dental
it
restoration?
can improve the appearance of your tooth, but not the restorative material or whatever fillings you place, a crown or
Okay.
a
Hmm.
composite. It cannot change the appearance of those. And
Okay.
generally, it is recommended that after teeth bleaching, it's better to wait for 2 to 3 weeks to go for any anterior fillings, because the bond strength, the binding capacity of the materials to the tooth will be decreased significantly after bleaching. So if you
Yeah.
want to restore your tooth, wait for at least 2 to 3 weeks after your bleaching procedure.
Understood. Okay. So, how can children or teenagers who are below the age of 18 years, they can have, what options do they have to whiten their teeth? Children or teenagers below 18 years, what options do they have to whiten their teeth?
The same options are there, but it is
Okay.
generally not, there's no contraindication, like you shouldn't go for tooth whitening, but it's better
Mhm.
to go for aesthetic whitening after the age of 60.
Okay.
So for kids who have traumatic tooth, anterior tooth, a black single tooth, then we go for walking bleaching. A procedure wherein
Okay.
a root canal would be done first, and then seal the root part, and then we keep a bleaching agent inside the root canal. So the root canal, here the bleaching will not be done on the tooth; it will be done within the tooth. And with that, the patient goes home and comes back to you after a week.
Hmm. Okay.
So this
Okay.
kind is mainly done for psychological improvement, improve psychological well-being of the kid.
Yeah. Understood. And that is your right. That is the case. A lot of people feel confident once they have a white smile restored, or probably when they feel good about their teeth, their overall confidence improves. Right. So that is always the case. Now, so how should a person know if they are a good candidate for teeth whitening? If teeth
Okay,
whitening
that's a good
is a good
question.
option for them to know.
Okay, that's a good question. The first thing is, if you already have a sensitivity, you're not a good candidate. So already
Okay.
pre-existing sensitivity could be because of tooth erosion, tooth wear and tear, or it could be because of some systemic illness like acid reflux that you have. So if you have these, then you're not a good candidate. Or if you have a gum disease, you have bleeding, a severe bleeding from your gums, you have inflamed gums, then also you're not a good candidate. If you have exposed root surfaces, you're not a good candidate. So if you have a healthy mouth, then you're a good candidate for a bleaching procedure.
Understood. Understood. So first you need to have a good oral hygiene and general wellness in your teeth. Then only you can consider it. Understood.
Yeah. Because in
Okay.
very small group of people, there's a chance that the bleaching agent can cause mild gingival irritation. So it's very important that your gums are healthy before you go for a bleaching procedure or whitening
Okay.
procedure.
Right. And now a very interesting question comes, doctor, that is with regards to expecting moms. So, can expecting moms go for teeth whitening, or will it have any impact on their newborn ones? For example, if they have recently delivered, for example, then for the kids breastfeeding, would it be safe if they have gone for the procedure?
Yeah, that's not a contraindication. Being pregnant or a lactating mother is not a contraindication for tooth whitening
Okay.
procedures. But a pregnant woman, I suggest if you have severe morning sickness, I would suggest you avoid it during those times. Because the vomit
Okay.
itself can have an erosive effect on your teeth. So this being superadded,
Okay.
it can increase sensitivity. So for
Mhm.
pregnant women with severe morning sickness, avoid bleaching. Otherwise, it's safe. There's no
Okay.
contraindication
Okay.
as to use. But it's generally an aesthetic procedure. So I think it could be delayed. Teeth whitening can be delayed. It's not a vital procedure or a pathological state. It's only an aesthetic concern.
Okay.
Not a pain
And,
that
and
could cause.
and in general, doctor, are there any health risks, potential health risks that are associated with teeth whitening? somebody have some other issue after this procedure?
No,
Okay.
nothing of that sort. It's just
It's
a
completely
transient hypersensitivity or a transient gingival irritation, or sometimes when people do have an over-the-counter varnishes or gels. So when they do not rinse properly, or when it goes into the foot pipe, they may have mild burns. So some over-the-counter medications you have to use them very consciously.
Okay. Okay. So how does professional teeth whitening procedure compare to the over-the-counter products?
Okay, so when it comes to the over-the-counter products, definitely you're going to have the bleaching agent, the whitening agent composition is going to be a small concentration. So you're not allowed to prescribe a huge concentration as what we use in the in-office. So it comes in contact maybe 1 or 2 minutes per day. So when you rinse your mouth or when you brush your teeth, so the process is going to be very slow, or for few people you may not have any reaction at all. But when it comes to an in-office procedure, which is going to be monitored by the dentist, your effect is going to be good. You're going to have more whitening results. Um, time taken to see the result is going to be almost immediate when compared to the over-the-counter products.
Okay. 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 Understood. And does using inhalers for asthma affect the teeth color?
Yes, it can. For few, it can. So there are scientific reasons which say that the drugs in the inhalers can decrease the pH. So it can have an erosive effect on the tooth itself, and so you can have a tooth discoloration.
Right. Right. And what are dental veneers, doctor?
Okay, dental veneers are those which we give when the tooth whitening procedure that we've spoken of before, they fail. So there are some stains that are incorporated into the enamel, which can result in the tooth mold, like the tooth structure, the enamel itself will be deformed. For such cases, what we do is the topmost layer of the tooth is the enamel, especially in the front surface alone, only on the buccal surface or the surface which people see. So a small layer of enamel is removed and you place a ceramic coating over that.
Okay.
So this is a direct veneer which is done in the laboratory, and the results are long lasting. But if you go for a composite veneer, the results are short.
Okay.
Maybe
Okay.
like in the results are short, it means that it can be stained by your extrinsic stains, like having a tea or coffee can stain them. So you may have to go for repeat veneering after a few years.
Okay. Okay. And how to take care of these veneers?
The regular, as you take care of your teeth, you have to maintain proper oral hygiene, floss regularly, brush twice daily, and technique is very important because the veneer tooth interface should not have any plaque accumulation. So that is very important. Maintaining proper general hygiene is sufficient to maintain veneers.
And are these permanent veneers?
Yeah, I told you there are two types of veneers depending on which it is permanent. So if you have like if the veneers are given to the lab and you get them back, it stays for a longer time. So composite veneering stays for a shorter time mainly because of the staining potential.
Right. And how important is flossing of your teeth to maintain the appearance and teeth whitening?
It's very important that you prevent the plaque accumulation in the gums because they eventually they harden and they become yellowish. So that gives an anxiety appearance, and you have to visit a dentist to go for a procedure called scaling in order to remove the stains. So it's very important that you prevent the plaque.
Okay. And how effective is the teeth whitening strips, doctor?
Teeth whitening strips, it's an over-the-counter product. So what they do is generally they have a plastic which contains the bleaching agents or solutions, and it's applied over the teeth. So when compared to every other teeth whitening solutions in the market, this is good. But in comparison to the professional in-office bleaching, it has less results.
Okay. Right. Understood. Now, can chewing gum, it helps in teeth whitening?
Very little effect. It has a very little effect. Literally, many people may not see effects. So it's got nothing to do with an effective tooth whitening.
So negligible effects of teeth whitening, because a lot of gums promote by saying, okay, it whitens your teeth or makes it look brightened or something like that. But negligible effect is what you say.
It can act on coffee and tea stains. Maybe it's very little and very negligible.
Very negligible, right? That was our last question. Thank you so much, Doctor, for joining us today. And it has been a wonderful session. I'm sure a lot of people will benefit because it's a confidence boosting procedure to understand how you can brighten your teeth. How can you can brighten your smile. So more important for everyone, guys, not only brighten your teeth, but share your smile with everyone. Keep everyone happy around you and be happy always. And at Cureka, our aim is always to take care of you, to help you lead a healthy life. So let us know if you have got any questions around your healthcare, you have got any questions around specific concerns, and we will plan to have the specialist doctor request them to. And we look forward to connecting with you again in the future. Take care. Bye.
Thank you. Yeah, bye.